From the News Channel 5 Network, this is OpenLine.
Hey everybody, welcome in to a Monday night here on The Plus. Rhori Johnston sitting in for Carrie Sharp, who is off today. And great to be here on a Monday because, you know, it's springtime. We always kind of look at the new season as a chance for new hope, turning over a new leaf. We're kind of invigorated, and this is a great topic tonight. How to be a positive bystander. Now, people are looking at that kind of saying, bystander, what do you mean? Well, it's a very important topic. This is going to tie in to bullying. Specifically, we'll talk about childhood bullying, but, you know, bullying can happen really at any age. And the role of the bystander, as I've learned very quickly through some of my notes here, and we're going to learn tonight, is very, very important. So we want to welcome our guest joining us via Zoom from New York City, and that is Dr. Limor Weinstein. She is the executive director of Bespoke Wellness Partners, a licensed psychotherapist, eating disorder specialist, practicing there, has a number of degrees, very impressive resume, and we're so pleased that you could take a little time to join us here on our airwaves, not only in Nashville, but all throughout Middle Tennessee. So welcome, Doctor.
Hi, thank you so much for having me. Thank you.
Great to have you. We were talking just before the break. We're having a little audio difficulty, not with folks at home, but just with me. But I can now hear you through the speakers in our studio, so we'll work through all of this. But again, we're so glad that you've joined us. First of all, tell me a little bit about yourself and your background and how you came to be in this role with Bespoke.
Right, so I've been a therapist for 15 years now, and I struggled myself with anorexia, bulimia for 10 years, so a lot of mental illness challenges. And so I always wanted to be a therapist, and I opened Bespoke Wellness Partners a day before COVID, so it's kind of insane. And one of the unique things that we're doing here is basically I have researched and created a method that is, you know, basically has a process to therapy where I'm helping individuals. Basically, we personalize the treatment for individuals. So if we have, for example, a teenager that is coming, or whether he was bullied or he's just dealing with anxiety or depression, we kind of get to learn about the individual and what they're like, and then we basically match them with the right therapist. And it's a really nice, welcoming environment, and we're a group of about 15 therapists. So
and how has it been to now, you know, you do all this research, you've got all of your experience as a psychotherapist, you've talked with others, like you said, you're researching, studying, and it would seem kind of obvious that a one-size-fits-all solution just doesn't work. And you probably saw that through your years in practice. So you start coming up with this method, but now to put it into practice and to see kind of real-time results, how has that been?
Right, it's very interesting because basically what we do is we kind of give the client a wellness test before they start the program, and it's a 3 months kind of intensive program where they get a lot of skills and tools, and once we kind of get to know the individual, if let's say they like music or they like writing or they like art, then we use their passion to help them overcome their challenges. So it's really, you know, really an interesting experience, especially with teenagers who don't always want to talk, or their parents push them to be in therapy. So it's more of like a coaching kind of experience and more collaborative experience.
And I was kind of glancing over some of the website information. Tell me how big the Wellness Partners group is now. How many people are involved?
Right, so we're a group of 15 people. We have therapists, dietitians, yoga teachers, meditation coaches. We also have a medical doctor on staff. And so, you know, basically, like we don't just see the teen, we see the whole family. So we have a couple therapists, we have a trauma specialist, we have an eating disorder therapist, and depending on what challenge the teen or the family is facing, I basically match them with the right professional, and
Right.
then they get kind of like all around support.
So speaking of challenges, as you mentioned, the pandemic, and I know because I have a family member who lives right in Manhattan, and it's been, you know, everyone kind of had a different experience through the pandemic, but knowing New York City so densely populated and what happened there, the lockdowns, businesses struggled, and we know it's caused a lot of stress and mental health issues for a lot of people. Tell me about that process and what you're seeing now and how business is doing overall.
Yeah, so, you know, a lot of businesses, of course, shut off. I mean, my business has been like flourishing. And the big problem that a lot of families are having living in Manhattan is like the space. There's no space. So even, you know, at the beginning, we would do a lot of Zoom therapy, which I don't like as much. I mean, I think it's much better and more efficient to have somebody coming to the space. So I've been open, you know, for 2 years since the beginning of the pandemic. I would wear a mask. I mean, I would want to see especially the kids, because they cannot really do therapy in their small apartments. So I think it is, you know, it's a big challenge to be in a small space and to have to do therapy. And for the parents too, they have no privacy at all.
Yeah. We're going to kind of narrow this down and then go to our first break in just a moment, Doctor. And just a reminder to our viewers, as we get into more specifics here and talk about what being a positive or active bystander means to particularly a young person, we're going to dig into that. And we'd love to hear from you folks at home. As usual, we call it Open Line because we open our phone lines to all of you. 615-737-PLUS is the phone number if you would like to call in for a little bit later and ask a question or share a comment. We'd appreciate it. So let's focus in now. You work with a number of young people. Give me kind of a range of age of some of your clients or patients.
Yeah, so it's anywhere from like 7 to, you know, like 70 years old. I mean, I love the teenager, like trouble kind of age. And I think it's important to know how to talk to them so that they can actually hear you, and also deal with a lot of the parents that are not always easy. So the ages like range, but I love the, you know, like 8 to even like 25 age range. It's my favorite.
What is your take right now, Doctor, post-pandemic, well, almost post-pandemic, we hope, of what you're seeing? I mean, we have heard, you know, we've seen so many headlines given the stresses that these kids have faced, not only with being, you know, going to school remotely, but also, like you said, even getting help. If you're getting therapy, a lot of it was over Zoom or Skype, not as effective as the one-on-one. So what are you seeing right now, your biggest concerns?
Right, so a lot of anxiety, a lot of depression, a lot of addiction, weed, other drugs, eating disorders is on the rise, and it's really scary. I mean, the hospitals are full. I mean, we accept patients after they went to a higher level of care. And it's like we're kind of like a step down program, but like we've been like booked, and we have a wait list for, you know, 3 months now. So it's just been, you know, so many teenagers are struggling, and the parents don't even know what to do, which is why we focus a lot on skills for, you know, the parents as well. Yeah,
well, and on the bright side, at least they're coming forward and taking some action, right? That's sometimes the toughest step.
Yeah, that's the most important step. And also, I mean, one of my goal and mission is to destigmatize mental illness and to promote wellness, and especially with teenagers. So one of the exciting things that we do is we get the teenagers involved in the experience, and they end up mentoring other teenagers when they feel better. So it's kind of like giving back to the community and helping to, you know, spread the word and to speak up, because there's a lot of, you know, shame and embarrassment about, you know, feeling anxious and feeling sad, which is a very normal experience, especially with the pandemic.
Yeah, and that's great to hear. That's kind of they're paying it forward with what they're learning, and it's positivity. I have two kids in college right now, so I have a little bit of an idea of what this, what they're going through, the anxiety and the stress. So we're going to dig into being a positive bystander, what that means, and much more with Dr. Weinstein when we come right back here on Open Line. Stay with us.